Let's roll. So, Excellencies, distinguished guests, friends and colleagues, good morning to you all. It isn't easy to begin the day by speaking about violence, loss, and fight against impunity, yet the room is quite full with people who care, who act, and who show up. Your presence, both in person and online, is a powerful reminder that we do not look away, so thank you for that. With today's important event on the protection of humanitarian workers, we come together because we believe that those who dedicate their lives to helping others must be better protected and must also receive the solidarity that they deserve when faced with harm. My name is Olivier Van de Castel. I'm the founder of Protect Humanitarians. We're dedicated to advocating for better protection and focus specifically on duty of care and mental health and psychosocial support. We're also there to amplify the voices of victims and survivors. Having myself endured the experience of arbitrary detention and torture, I'm honored to serve as your moderator today. The urgency is clear. 2023 and 2024 marked 2 consecutive years of record high incidents against humanitarian workers. Each of those lives mattered. Each loss is a call to action and to do better. Diplomatic efforts are underway, and we will hear from one of the member states leading them. Donors are also engaging, and dedicated NGOs have stepped in. But it is not enough. The scale and the persistence of these incidents required sustained and survivor-centered responses. As per the UN Secretary General recommendations to the United Nations Security Council, families of victims must be heard and survivors deserve a seat at the table. Also, the sector continues to fall short of ensuring equity and minimum standards of care and support, in particular for local staff and national partner NGOs. In this event, we'll look at efforts. We'll try to move beyond statements of solidarity and calls for the respect of IHL and look at how we can make prevention stronger, care more supportive, how we can build accountability mechanisms and protection that truly reaches those on the front line. We have a powerful program ahead. We will begin with opening remarks from 2 distinguished speakers who will help frame the conversation. We will then hear a testimony from an organization that has experienced incidents firsthand. After their testimonies, we will open the floor here in the room and also online on the chat for organizations who wish to share experiences, challenges, and possible solutions. Then we will move into our panel, 3 expert voices who will help us draw concrete actions and solutions to strengthen the protection of aid workers. With that, let me welcome the first distinguished speaker, so Her Excellency Emily Roper, if you can hand over the mic, Ambassador, Deputy Permanent Representatives and Chargé d'Affaires ad interim at the Permanent Mission of Australia to the United Nations and other international organizations in Geneva. The floor is yours.
Thank you so much, and good morning, Excellencies, colleagues. Welcome to today's event. Australia is really honoured to co-host today's event on translating policy commitments into life-saving actions for humanitarian personnel. As our Foreign Minister emphasised, Australia is a long-term advocate for international humanitarian law. The protection of civilians, including humanitarian workers, is very central to this. As many of you know, at least 379 humanitarian workers were killed in 2024, and that is the highest annual toll on record. Almost 97% of those killed were local or national staff. The growing number of fatalities and incidents involving humanitarian personnel is unacceptable, and it is imperative that the international community takes decisive action. Those who dedicate their lives to aiding others should not have to do so at the expense of their own safety. International humanitarian law is clear and comprehensive on this issue. What needs to be strengthened is commitment, compliance, and diplomatic engagement. To this end, Australia is working with international partners on 3 related initiatives. The first is to pursue a new declaration on the protection of humanitarian personnel. This initiative was announced at the UN General Assembly in late September 2024 by a cross-regional ministerial group convened by Foreign Minister Wong from Australia and consisting of Australia, Brazil, Colombia, Indonesia, Japan, Jordan, Sierra Leone, Switzerland, and the United Kingdom. We continue to work hard in the Ministerial Group to progress this initiative. Our goal is to galvanise international commitment for the protection of humanitarian workers who, under the most challenging circumstances, dedicate their lives to protecting civilians, alleviating human suffering, and delivering life-saving support. Seizing the momentum created by the adoption of the UN Security Council Resolution 2730, which Australia was very proud to co-sponsor, the initiative aims to strengthen international commitment and translate it into tangible action. The declaration sets out practical and actionable steps to protect aid workers in conflict zones under 4 broad themes: adherence to international humanitarian law, safe, rapid and unhindered humanitarian access, alignment of protections for local, national and international personnel, and we note that local humanitarian workers are 22 times more likely to be killed, injured or kidnapped than their international colleagues, and accountability and justice in response to incidents. On-the-ground insights from humanitarian organisations have played a really central role in informing the development of the declaration, and once finalised, all states will be invited to join the declaration. Advocacy by humanitarian organisations in marshalling broad global support from diverse cross-regional member states to join the declaration in due course will be quite key. Complementing the declaration, the second initiative is an international pledge on enhancing the protection of humanitarian personnel. Launched at the 34th International Conference of the Red Cross and Red Crescent in October 2024, the signatories commit to advocating for and taking practical action over the next 4 years to promote respect and comply with international humanitarian law. The pledge is open for signature until the end of 2025, and we invited all states and national societies to join this pledge if they hadn't already done so. And finally, Australia has also proudly joined the ICRC's Global Initiative on International Humanitarian Law and will be a co-chair of Workstream 1 on good practices for preventing violations of international humanitarian law. Now is a critical time for member states to not only reaffirm their commitment to promoting compliance with international humanitarian law, but also to take robust, well-informed action to prevent violations of international humanitarian law and limit the devastating impact that conflict has on civilians, including aid workers. We look forward to being an active supporter of this initiative. So, as you can hear, there are a number of initiatives underway at present, and they build on related initiatives over many years. The key will be implementation, and that's where we can all play a part. Before I conclude and pass back for the rest of today's event, I did want to thank the humanitarian organisations and workers who continue to work really tirelessly in the back offices and on the front lines to deliver the urgent assistance to millions of people in need that is so important. The international community has an essential role in ensuring that your vital work can continue safely, and Australia is committed to doing our part to lead and support initiatives that contribute to achieving that. Thank you once again for having Australia be part of today's event.
Thank you very much, Ambassador. And now I'll hand over the floor to the European Commission Humanitarian Aid Office, represented by Dorota Kashuba, in charge of the regional programs MENA, Southwest Asia, and Arabian Peninsula. Yes.
Thank you. Good morning, everyone, and thank you for inviting me. I'd like us to take a moment to contextualize the event that we are participating in today. The issue we are addressing, the protection of aid workers, is not a new challenge. In fact, the humanitarian community has been engaged in conversations around the definition, scope, and response to this problem for over 20 years. We have taken the time to document incidents, to quantify trends of violence against humanitarian action, and seek to understand the underlying causes and motives. Several landmark initiatives have emerged during this time, including key data collection efforts. So I just enumerate a few of them. Already in 2005, so 20 years ago, Humanitarian Outcomes launched the Aid Worker Security Database. 3 years later, in Security Insight, introduced the Security in Numbers database. And fast forward 20 years, Geneva Academy recently published the much anticipated IHL in Focus report, which focuses on IHL violations all over the world. These efforts have been invaluable in shedding light on the risks aid workers face. Although significant challenges related to data remain, and accuracy, reliability, and comparability continue to hinder our ability to use the data effectively to inform both humanitarian policy and action, globally we can say we're there, we made progress. Now, turning to political and policy efforts, we have seen also numerous initiatives aimed at improving the protection of humanitarian workers. The UN Security Council has passed at least 6 resolutions addressing this issue. So, for example, UN Security Council Resolution 1502 from 2003, UN Security Council Resolution 1674 from 2006, UNSC Resolution 1894 from 2009, and so on. And more recently, of course, the Resolution 2730 that was passed in May 2024. These resolutions underscore the international community's theoretical commitment to improving security for humanitarian personnel. The European Union, which I represent today, has been at the forefront with its humanitarian legislation, which integrates the protection of civilians and humanitarian staff. Let's name 2 legal acts that directly address this issue: the EU Guidelines on Protection of Humanitarian Personnel from 2008, and the COAFA Common Messages on the Safety and Security of Humanitarian Workers that, again, fast forward 2024. There have also been political initiatives such as international conferences and advocacy efforts. At the Red Cross and Red Crescent conferences every 4 years, political pledges are made. Public condemnations on IHL violations are abundant. The political actions, such as the one introduced by our honorable Australian colleagues, reflect a continuous global call for action. Also, when it comes to what the sector could have done for itself, I believe we have made a lot of progress. Over the last years, we've seen substantial evolution of the security risk management and duty of care. We've moved from merely acknowledging security as a component of humanitarian action to recognizing it as a core element of the mission itself. The adoption of formalized security policies and the increased use of technology have strengthened our ability to assess risks, improve training, and foster better coordination between humanitarian organizations. Humanitarian organizations, military forces, and local actors. In parallel, duty of care has transformed into a shared policy among many organizations. Not only is it now ingrained in their operations, but it is also supported by external mechanisms, such as the eco-funded Protect Aid Workers Fund, which David will elaborate on later. The point that I want to emphasize today is that significant efforts have been made. But when we look at the data on critical incidents, those tragic events that affect our colleagues, the trend is undeniably troubling. The number of these incidents continues to rise year after year. Despite the wealth of data, the insights we've gathered, and the initiatives we've launched, the outcomes seem elusive. In places like Gaza or Sudan and other conflict zones, our collective humanitarian advocacy with governments, both in the open and behind the scenes has led to minimal changes in policy or military tactics. In fact, in some cases, militaries have been obstructing or endangering humanitarian aid rather than facilitating it. So the numbers grow. And of course, to understand the issue of trends with scientific rigor, we would need to take into account various factors, such as the number of active military conflicts that we have now and that we had 20, 15 years ago, changes in how we collect data over the last 20 years. And we should also notice that 2024 was marked by particularly brutal violence in Gaza and Sudan. And so the year might be considered as an outlier statistically. I also recognize I might be biased when I look at it. Having spent 10 years in operational work, I am used to see concrete results. But as I reflect on the facts before us, I cannot help but recall the phrase attributed to Einstein. Insanity is doing the same thing over and over again and expecting different results. I leave you with this thought to set the stage for today's discussions. How can we break free and truly better protect our colleagues in the field? Can we at all, and if so, how can we influence warring parties to fulfill their duty to protect and facilitate humanitarian relief efforts? I challenge all of us today to think beyond the generic calls for more advocacy or diplomacy. We need fresh, actionable ideas and concrete examples that go beyond the well-worn rhetoric. The goal is clear. We must reduce the risk to our colleagues, especially our local humanitarian staff, and ensure that fewer are killed, wounded, or threatened while carrying out their vital duties. Thank you.
Thank you very much, Dorota, for both the comprehensive recap and a very strong message. I would like now to hand over the floor to Jeanne Frangier, who is with us online. She's the founder and director of Himayat Daim Atta, which is a woman-led NGO based in Lebanon, which was recently affected by an incident. Jeanne, thank you for joining us online. We wish you would be here with us, but thanks for making it. And basically, the floor is over to you. Thank you.
Yeah, good morning, everyone. Thank you very much for considering us to be there today with you, providing what we had passed this 3 months ago. So today in my intervention, I will be focusing on the critical subject of protecting humanitarian aid workers and the importance of international humanitarian law, and the type of support an organization needs after an incident affecting its staff. So as we may know that humanitarian aid workers operate in some of the most dangerous and challenging environments, and often putting their lives at risk to support vulnerable populations. However, these workers continue to face attacks, threats, and increasing difficulties in conflict zones. So despite the existence of international humanitarian law, which is designed to protect those delivering aid, we are seeing precedent violations that put aid workers in harm's way. So many parties to conflicts fail to uphold these laws, making humanitarian workers particularly vulnerable. So as a prime example of this was the experience of one of our colleagues who was severely impacted by an Israeli airstrike during the October 2024 war. This incident highlighted not only the dangers faced by aid workers, but also the critical need for immediate and effective support when such tragedies occur. So it is at that times that organizations need structured and comprehensive support systems in place. And without Protect Aid Workers initiative, we couldn't continue. The Protect Aid Workers initiative plays a crucial role in such situations, When our colleague was affected, Protect Aid workers provided immediate and vital support in various forms. First, covering part of her hospitalization costs, because as you may know, we do have insurance, but with this economic crisis that it is passing through Lebanon, the social security and other issues are not fully covered. So that's why the hospitalization was not fully covered, and that's why we had the support of Protect Aid to fulfill this gap. It was assisting the car repair as well and offering psychological support through counseling, because our colleague was really hardly traumatized, and she needed mental health and psychosocial support. So she was recovered, hopefully, but without the support of Protect Aid, she couldn't continue her career. So without this kind of support, it would have been extremely difficult for her to continue her career and recover from the trauma. This initiative ensures that aid workers, when injured or traumatized, receive the necessary care and assistance to continue their work, both physically and emotionally. And I can add on this that it's not only the support that was given for her, but if she was not recovered, our work as organization, it would be affected as well, because you know that she's a social worker and she's very well trained to support services and to support vulnerable people. So if she wouldn't have been there again, this will affect our work, and the service would never been at such high quality for our beneficiaries. So for a humanitarian organization, this type of support is invaluable. When an incident occurs, the immediate priority is to ensure the safety and well-being of the affected staff. This involves not only addressing their physical injuries, but also providing mental health support to help them cope with trauma. And this is very important. So Protect Aid workers provide this much needed safety net, ensuring that workers can regain their strength and continue their work in communities that depend on them. Furthermore, Protect Aid workers is not just a matter of individual well-being. It directly affects the sustainability, and I say sustainability of a humanitarian effort. This is very important. And when aid workers are not protected or supported after incidents, their ability to continue delivering services is compromised, and this is not acceptable. This leads to reduced capacity to assist those in need, and particularly in situations where the most vulnerable population are at risk. And here I'm talking about the AAP, our accountability toward affected population. This is very important. So in conclusion, ensuring the protection of humanitarian aid workers and adhering to international humanitarian law is essential in maintaining the integrity of humanitarian work. It is crucial that organizations have mechanisms like Protect Aid workers in place, which provide immediate and long-term support for staff who experience critical incidents and who is filling the gaps. And it's very important as well to upscale such cases, because I think that the work of Protect Aid workers is very important and should be upscaled. And maybe it should be as well filling more gaps, such like maybe legal aspect, because we as organization, we were affected and we cannot have any support at the legal level. So I think it's very important if as well Protect Aid workers can be more supportive in this issue as well. So in addition to all the support that it's provided by Protect Aid, there is a need to provide more support as well for the organization itself, who experienced this incident as well. So this not only safeguards the well-being of workers, but also ensures that the humanitarian mission can continue uninterrupted, helping those who need it most. Thank you.
Thank you very much, Jean, for speaking out on behalf of your colleague, and thank you very much for sharing all these insights. Now, actually, before we move to the expert panels and some of the solutions that are here presented, we actually wanted to take a time with the people present here, either in the room or online on chat, if you would have questions or insights that you would like to share. In particular, experiences maybe of incidents, type of actions that are undertaken, but also type of support that you would also request. I can see already one hand up there. Yes. And then we need the mic. Thank you, Anissa. Thank you very much. Yeah.
Thank you very much. Hello, everyone. I'm Léa Gauthier from Médecins du Monde, Doctors of the World, and thank you for the opportunity to share a few words and our experience. At Médecins du Monde, we used the Protect Aid Workers initiative when one of our colleagues, Dr. Maïsara Reyes, was killed in Gaza in the bombing of his house in December 2023. And so his family received support thanks to the initiative. That incident also triggered our organization to reinforce and adapt our own duty of care policy. So we have now set up financial support for our staff in Gaza, but also later extended it to the West Bank and Lebanon. So financial support to help staff find food when it is available on local market, and also support housing. And despite that, more than 20 of our colleagues still live in tents or garages or even in their car. There is also a mechanism for psychosocial support because, as Jeanne mentioned, it is critical for staff who experience daily trauma and still continue to work and support others. And my colleagues in Gaza and the region have mentioned how important this Protect Aid Workers mechanism was, how important it is for them to feel the solidarity of the profession and to feel that there is a support mechanism from inside the profession that exists. But because MDM, our own duty of care, doesn't cover everything, or other organization cannot afford such extensive duty of care, it is also why these mechanisms are so important. But my colleagues in the field also mentioned that no amount of money can replace a loved one or a treasured professional, for instance. So this is why it's so important to be reminded that what they need, what we need still now is, of course, a permanent ceasefire in the region. And for that, political diplomatic pressure. We have heard about calls for action, but states do have the power to take some pressure, to make some political diplomatic pressure, and to act against IHL violation, to put pressure on states against IHL violations and for the protection of humanitarian worker. Thank you.
Thank you very much, Léa, for sharing this insight. I can see several more hands. Yes, thank you. Christina?
Hello, good morning. Christina from Insecurity Insight. Thank you for putting on this really important event, and also thank you for Australia and the European Commission. I thought these were really important sort of words to frame this whole discussion. I want to add one additional point that I think is really important, and that we think very much about the local aid workers. And by that, I don't just mean the local national staff of international aid agencies, but those volunteers or local community-based organizations that do so much in conflict these days. And the more we're talking about the shrinking humanitarian space, the access difficulties, the more important these organizations are in delivering the frontline aid. And it's all obviously linked to the localization discussion. So the point I really want to make here is that the support that the Protect Aid Worker system is providing is vital. And I think Léa has put that really well. But I think what we need to ensure is that it remains open to any aid communities. And for that, I think it is also really key that we think of the mechanisms of how we connect these communities to these systems, how we know what has happened to these communities, in particular when they're not part of the official cluster system, they're not necessarily reporting within the mechanisms we have. And I think that's one of these sort of challenges. As Insecurity Insight, we try to do our bit by really seeing how we can connect to local communities using the reporting technologies that are out there. And this is sort of the last point I made there. It is extraordinary how that has changed over the last few years, with in particular these conflicts that are well connected to the internet. It is the individually affected communities and people themselves who take to the internet and report what has been happening to them in ways that we've not seen it a few years ago. And I think that is a real opportunity we have to harness to make sure we use these mechanisms to bring these communities into these really important supporting networks that really are essential, I think, as Leah said it, to rebuild the morale and the commitment to the vital work they're doing. So thank you.
Thank you very much, Christina. Hélène, yeah.
Good morning, everyone, and thanks a lot for this very important session. And thanks a lot, Jane, for talking about your organizations. My name is Helen Ross. I'm the co-founder and president of Co-Create Humanity, a Swiss association based here in Geneva. Co-Create Humanity is a very humble initiative. We provide peer support to the humanitarian colleagues. And when we talk about humanitarian peer support, the principle is recovery. It's really important to have that in mind. And as you know, there's a big gap between how international staff and local staff is treated. So mainly we are reaching the local staff, providing peer support through volunteers we have. It's a small community, but we are doing a lot. And beyond peer support, we are also developing care protocols with mental health professionals. We are currently constituting a scientific committee with well-known mental health professionals who are specialized in PTSD, burnout, compassion fatigue, vicarious trauma, etc. So I would like to encourage people to reach Co-Create Humanity because we are outside organizations. This is really important to know that we have this neutrality and that we can help the humanitarian colleagues who are suffering. We, in our beneficiaries, we have the young generation of humanitarians. We have people who are currently deployed in the field, and we also have people who are retired from the sector, and we also support their families. So this is a very humble initiative, but we need you to spread the word. And we also do some advocacy through art and music. And it's really important to recall that there are many means to support the colleagues, and peer support is one of them. Thanks a lot.
Thank you very much, Hélène. I believe there was, yes, here, speaking.
Yeah, we have two questions online, so I'll just read them both. The first is from Lamia Bezer, who writes, violence against aid workers is increasing. To learn how to protect our colleagues in the field, we must understand why it is happening. The disregard of international humanitarian law is one reason, but are there other factors that do not depend on the perpetrators? For example, is a lack of neutrality what exposes aid workers, particularly local aid workers, more to violence? And if so, how might we mitigate this? And the second question is from Steve Dennis, who writes, security threats are a main focus, but not sole responsibility of aid worker harm. Safety risks also injure and kill aid workers at high numbers. The responsibility of understanding all risks to aid workers and put in reasonable measures to manage them comes from aid organizations that direct them in high-risk context. So he asks, what can the panel say about holding accountability for the aid organizations themselves?
Maybe if I can suggest, because there are two questions, I think we will try to take them with the panel of experts that will follow after. And if not, we will answer them specifically after. Are there more interventions from the floor? Or also experiences they want to share. Camille. Oh.
Okay, sorry. Okay. Hi, so this is Anthony from INSO, the Director of Policy Advocacy and Communications. Firstly, thank you for convening the panel and sharing your experiences. I think that's really powerful, particularly those of you who've experienced your own incidents or been impacted as organizations. I wanted to reflect on our colleague from ECHO, because I think it's important to also emphasize that we have come a long way, right, from the baseline. Despite what we've seen in this kind of terrible 2 years, we have made progress. As you mentioned, humanitarian outcomes and security insights. INSO as also a platform that helps people to manage security risks in the field. But I wanted to maybe highlight or put 2 questions. One builds on Christina's point. I think based on my own experience when I was the coordinator in Sudan and working with emergency response rooms, one of the key factors was, as we see or recognize a diversity of actors in the aid sector, we also need to recognize that the approaches to security risk management for those local actors are not going to be the same as ours. And we need to be more agile in terms of what are the approaches that we can support to enable them to manage their own risk effectively. And it will not look like NGO security risk management. And I think this is where perhaps we need to lean more into some of the mechanisms that the human rights sector use to protect their defenders or to enhance the protection of their defenders when we're looking at a broader degree of actors in the aid sector. I think also what we're seeing, and I know that there's been a lot of focus on upholding international humanitarian law, which is necessary, but picking up on one of the questions raised in the chat in terms of what are some of the driving factors behind increased attacks, what we're seeing, at least in the data that we have as INSO, is an increasing criminalization of aid work, right? Both at a global level with politicization, but one of the key increases that we've seen this year is the confinement of aid workers. So those who are detained either illegally or legally in the area of jurisdiction in which they're worked, but detained for the action of speaking to a non-state armed group or trying to deliver assistance. And this, I think, requires some more specific political engagement at the international level. It's one thing to say, yes, we should uphold international humanitarian law, but I think more can be done within General Assembly resolutions, within Security Council resolution, within bilateral diplomacy between member states on ensuring that the act of aid work is not criminalized at the domestic level. Thanks.
Thank you very much, Anthony. And Camille now.
Thank you so much. I'm Camille Gosselin. I'm representing Action Against Hunger, based in France. Just a few years back, 20 years ago, in fact, you all know that 17 of our colleagues were shot dead in Muto. I'm saying that because next year it will be the anniversary of this tragedy. And we still don't have perpetrators that has been held into account. Neither nowhere, national jurisdiction didn't work, global jurisdiction didn't work. So there's still an angle, and thanks to Legal Action Worldwide as well, that we need to pursue in that track. And I just want to reflect 2 things about what Anthony said. One, on the criminalization of aid, it's not only a matter of urgency, but ensuring that we do have exemption in national laws. It's not only UNGA resolution, it's really practically by states here in Geneva, donor states, but also on the field, that when we do have to access some part of some countries, we are secured. And we can't be in a capacity to be going to jail. Another fact is that another important element is that security risk management. Yes, we need to be agile, but we also need to make sure that there are security lines available for everyone, including international, but also national aid workers. And we've been calling out with partners as well to make sure that with the funding cut that is arriving, that is there, we will not be that donors will not forget. That's extremely important track. And two other last point from my side, and I will stop there. But we're ready. I know that advocacy is sometimes seen as difficult in that field, but we still need advocacy. We need a humanitarian effort, diplomatic engagement, private, joint, private towards states, but also global. And we need also state to speak out, not only per incident, but globally and more systematically. Thanks.
Thank you very much, Camille. I propose this is the last intervention from the gentleman behind. Thank you.
Hello, good morning. My name is Fergus from an organisation called Medevac Frontline, UK-based. We kind of do what it says on the tin, Ukraine, Gaza, and currently in Syria. I think I'd just like to address what I feel is certainly an elephant in my room. And that is that there doesn't feel to be sufficient support from the very top when I hear from at government level that certain activities are at risk of breaching international humanitarian law, when we're undertaking activities which are high risk. I feel that there is insufficient support from the very top. And, you know, it's a question for international humanitarian lawyers, but I just think that because it's being ignored at the very top, downstream when it comes to working in the field, there has become an increasingly an increasing awareness of the fact that, frankly, it doesn't matter. You know, if these things can be ignored at the top, they can be ignored in the field. And I'm just kind of raising that point because I feel that in the last 6 months, year or whatever, it's become an increasingly free field when it comes to ignoring humanitarian law. Thank you.
Thank you very much for sharing. So with that, I would like now to turn basically to our panel. We have 3 experts who will present what solution they offer to such incidents. We will hear consecutively from first David Anquin, director of the ACF-led project Protect Aid Workers, which provide financial grants to NGOs faced by incidents. We'll have second Kate Norton, who is the operations director of Legal Action Worldwide, who will focus on the provision of legal assistance and the role it plays in fighting impunity. And last but not least, we'll have Amjad Salim, who's manager for strategic engagement at the IFRC, and who will present in particular the IFRC's own initiative called the Red Family Fund. I would like to not forget the 2 questions we had from online. So, and maybe I'll ask the panelists to also maybe in their answers to possibly try to tackle these questions. So we had Lamia who asked, what are the reasons of the increased violence? Is it only disregard of IHL or also issues with regards to perception or neutrality? And we had Steve Dennis's question, which is an important one as well, which is about not all incidents being targeted incidents, and basically what about safety and risk in the organization and duty of care more broadly? Maybe David first. Over to you.
Good morning. So I am the program director of Protect Aid Workers, which is an initiative funded by DG ECHO and run by a consortium of several organizations, including Protect Humanitarians, Legal Action Worldwide, Global Interagency Security Forum. So it was already said that Protect Aid Workers was created in recognition that aid workers are facing an increasing level of exposure to attacks and violence against them, and that local aid workers are paying a heavy price for delivering assistance, as they account for 95% of the critical incidents worldwide. Also, it was said by Jeanne, impact is likely to be higher for local NGOs because they don't have many options to react when an incident happens. They don't have any compensation system in place. They don't have any insurance policy for most of them. And they cannot have access to medical evacuation also. So based on that, it was necessary to do something and to make sure that all aid workers can have access to a comprehensive package of care, of services, no matter if they are international or national staff. So what we do is that we provide financial support and legal support through Legal Action Worldwide to aid workers and their family members who are also deeply impacted, directly or indirectly, by the incident that affected the aid worker. So we support them, we support the ones who suffered from various forms of attacks, violence, causing injury or death, persecution, death threats, arbitrary detention, kidnapping, etc. So our grants can cover the cost of the response. It can cover healthcare, psychological support, legal fees, lawyer fees in case of detention. We can cover the salary of the aid worker also when the aid worker cannot work any longer because he's in detention or is in the hospital, etc. So this is very important to provide this safety net for local aid workers, as local NGOs don't have the means to cover this kind of cost most of the time. So we have launched the initiative a year ago now. We tested the program in Middle East and North Africa. Then now we have gone worldwide, and we have helped 160 individuals across 10 or 12 countries so far. Just to give you some examples, we helped to relocate and evacuate volunteers from the emergency response rooms in Sudan who are on a daily basis persecuted, detained, tortured, raped for female volunteers. So we supported their relocation to a safer place so that they can get medical care and be safe. In Middle East also, we have observed a wave of arrests in many countries such as Tunisia or Yemen. So we intervene also to cover the legal fees that can be super expensive to provide support, material and financial support also to the families during this hard time. And last but not least, in Gaza, as Leah mentioned, so many colleagues died under the bombs. So we provided financial compensation also to the surviving family members in OPT. So the implementation of our program, as I would like to share with you some lessons learned also from our program, from the case we have covered, and the challenges also faced by the implementation of our program. First of all, the data are very concerning, obviously, but I think they don't reflect the full reality of what aid workers are going through right now on the field. Many incidents are not reported, are not recorded, because sometimes local staff don't want to share what they went through. Or sometimes local NGOs don't report it to the different platforms or channels. The data don't show the people, our colleagues who are harassed, persecuted also because of the work they do. This is not shown in the database. And it is, but the reality is quite scary for them. So I would like to highlight that, but there is an underreporting issue of the critical incidents affecting aid workers worldwide. Another lesson learned or observation from the case we have covered is that despite all the speeches and commitments for localizations, most of the local NGOs are still years behind INGOs in terms of security risk management development, largely because of funding models that prevent them to develop core capacities to protect their staffs. And local aid workers are facing the higher risk, as it was said, and they don't benefit the same level of protection as their international counterparts. And from the cases we have covered, I can see that several incidents could have been prevented with a proper and appropriate security risk management in place. What challenge also for local NGO is to develop duty of care policies. They want to do it. Sometimes they have elaborated it, such as, for example, the local NGOs in Northwest Syria. They all gather together and develop minimum standards of duty of care. But they desperately need money to finance their duty of care policy. So we have to understand that local NGOs do care for their staff. I think you all know that, but it's important to say it. And they desperately need funding to make sure that they can implement it for their staff. Also, another challenge is the mental health, psychological support for local aid workers. So beyond financial aid, obviously, it's critical to address the mental health and well-being of humanitarian aid workers. There is still a widespread culture of silence, guilt, and stigma around it, and it prevents aid workers from seeking the care they need. But even when aid workers do seek help, the availability of mental health specialists or support in many humanitarian contexts is very limited. So, which makes very difficult for them for local NGOs to address this growing need. Another thing is about evacuation, medical evacuation, relocation of staff. I'd like to stress also that local NGOs don't have the capacity most of the time to ensure safe evacuations. They do what they can. Sometimes in some contexts, they cannot do anything because they are not part of the protocols in place to access to these evacuations. Or sometimes because of the legal and bureaucratic impediments also to manage cross-border evacuation. It's not possible, it's too complicated, it's too time-consuming. And sometimes what we can see is that local aid workers have to manage by themselves to get out of a risky location and find a safer place. So these are some preliminary lessons learned. I wanted to share it with you. And we welcome the humanitarian community to join us and helping us to scale up our efforts, our reach, and our services to the aid workers at risk today. Thank you.
Thank you very much, David. Kate, so on legal assistance, the floor is yours. Thank you.
Thank you very much for this opportunity, and also to my colleagues and panelists and other organisations who've made some very important interventions. Legal Action Worldwide is as you would expect, is a legal international NGO, and we work and we have lawyers based in many fragile and conflict-affected states, alongside humanitarian action. And in those countries, we're representing in national and international and regional courts many victims and survivors of international crimes and also human rights violations. And about 3 or 4 years ago, we started to realize that although humanitarians who are living and working in exactly the same context as our clients, and experiencing many similar situations and are the victims and survivors of many similar crimes, they're not coming forward for legal advice and certainly not demanding accountability and justice. Going back a few years ago, there was only one case of aid workers taking action, which was well known. That was the terrain case for South Sudan. But otherwise, very few organizations were coming forward. And what was happening is they were relying on public statements of condemnation, press statements, obviously also humanitarian and diplomatic interventions. But yet we've seen the number of cases increasing and impunity also increasing at staggering rates. So in 2023, so we started doing some research. We wanted to know why it was that aid workers and organizations are not pursuing accountability and justice for the crimes, and they are crimes that have been committed against their staff. That we spoke to about 43 organizations, and that includes international, local, and grassroots organizations through interviews and surveys. And we there were basically 4 findings that we found, which are very interesting. First of all, humanitarian aid workers or organizations themselves do not have access to lawyers. They're not taking legal advice. As part of many duty of care policies in organizations, they offer medical, financial support, psychosocial support, but they're not offering legal support to their staff. Now, there's also overwhelming perceptions that taking legal action is just too difficult, perceptions that courts do not function at a national level. There's no point in doing anything international. It just is very, very difficult. Also, not surprisingly, there are perceptions that should you take any legal action, should you report a case to the police or try and file a case, then you will lose access and also funding for your projects, even though, of course, because people are not taking action, there was very little evidence to support that. And finally, of course, one thing that came across very strongly was about perceptions and all levels of organizations, that it is the organization that is exclusively responsible for what has happened to the aid worker, rather we're almost at the exclusion of the perpetrator of the crime. And I'm going to take this moment to respond to Steve Dennis's question, if I may. Steve, thank you for the question. It is incredibly important. I think the thing to emphasize is that negligence of an organization and the fact that they have failed to set up security risk management, as David has mentioned, or that they have made mistakes in how they've managed incidences, is not mutually exclusive as the being able to take action against the perpetrator also. It can be that an organization has made mistakes or has been negligent, but also in addition, there are crimes which have been committed for which there needs to be an answer, that there needs to be someone held accountable for. So what we have seen over the last 5 or 6 years ago is that there tends to be a focus exclusively on the organization rather than trying to pursue perpetrators. Now, through a lot of advocacy and also with the support of Protect aid workers, we've seen actually quite a significant change. And there are organizations and aid workers coming forward at a much larger rate than has ever happened before to pursue legal action. And we have in the last year taken up 14 cases. Now that involves 16 organizations, which is about 50-50 national and international, reaching about 60 aid workers who've been affected by incidents and who are interested in pursuing accountability and justice. That is a significant change in organizations' attitude to this issue, and I think shows just how fed up we all are with the increasing levels of impunity. Now, these kind of cases are a range of things, including obviously where aid workers are killed or injured in difficult situations, but also arrest and detention. I think this has been mentioned now several times. Providing legal support or advice to an organization or to an individual is not just about filing cases. It's also, and I think this is something that's quite important, particularly in arrest and detention cases, and I'd just like to share some of our lessons learned from that. It's very, very difficult in an arrest and detention case to find a lawyer who has the expertise to support you to try and address the fact that your staff member is in jail. In addition to that, what we've seen very closely is it's quite often left to the legal departments in the head offices of these organizations to support, and managing those lawyers locally is a very difficult thing. Being able to ask the right questions, understanding the law and the jurisdiction in that country. They often, lawyers are not necessarily neutral, and in some of these countries, and there are incidences of corruption and collusion with judges, and being able to ask the right questions, being able to sense check that the case is moving forward or not, that makes in a way that makes sense, is incredibly important. I think also in some cases people are, and we've seen this again often with organizations, is there's a lot of concern that you will create more security issues for your organization by engaging in legal action. And what we do is we try and support organizations to understand the risks of different legal options before they make a decision to enter into it. And it is quite legitimate to decide not to take legal action. However, what is not appropriate is to not even understand what your options are, and to look at the different options available and to do a risk assessment before deciding what to take. Another aspect where we're able to support is taking informed consent of family members, which again is a very complex process. If you have to explain difficult legal concepts to family members in a different language, and to be absolutely sure that they are supporting the case, especially in the case of arrest or detention, where family may be concerned that they could also face retaliation, or they could also, it could make things worse for their colleagues and for their family members. And finally, we also engage with humanitarian diplomacy, and we also ask for senior officials in country to support in relation to legal work. So I just wanted to summarize there, but to conclude, I think it is really important that legal aid is offered to aid workers after an event, and that forms a very solid part of the duty of care package. But in particular, organisations are also open to hearing what options and exploring what options they have available, and get involved in that decision making in relation to these cases. The thing about arrest and detention, as I think we all know, is it is life-saving. The longer somebody stays in detention, the much more likely it is they are to be tortured. The much more likely it is that they are going to be pushed into a false confession. And in some cases, that can result in the death penalty in certain countries. Therefore, it's really not an option not to explore any legal ways possible to get people out of detention. Thank you.
Thank you very much, Kate. And maybe last, Amjad. So I think you'll mention specifically what the IFRC is organizing for its staff and volunteers.
Yeah, great. Thank you so much. And thank you so much for inviting me. So I wanted to perhaps start with not a direct answer to Lamia's question, but I think a story that may reflect some of the challenges that she's raised. So on the 15th of March this year, we had a volunteer from the DRC Red Cross, Fikri Antoine, who was on duty as a caregiver at the Bethesda Hospital in Goma on the 9th of 8th of March. And when the M23 rebels raided the hospital in search of interned soldiers, and he was carried out like everyone else who was found inside, despite showing his Red Cross ID to the rebels. And the rebels reportedly made the allegation that the Red Cross is reporting to the Security Council on all developments in Goma, effectively accusing Red Cross of spying for the US or the UN. He was reportedly detained and moved to the Unity Stadium, where he was invited to join the rebellion. The volunteer tried to explain that due to the principles of the Red Cross Reconnaissance movement, he would not be able to join the armed group. This reportedly angered the rebels, who proceeded to beat him. And 7 days after the beating, on the 15th of March, he died. Now, this story is one of many that we've encountered, where our volunteers on the ground, despite talking about the fundamental principles, despite talking about the principles of neutrality, repeatedly come across this notion that they're not neutral or they're not impartial. It also shows a increasing disregard for understanding the role of frontline responders, understanding fundamental principles, understanding humanitarian principles. Since 2023 January, the Red Cross Reconnaissance movement have lost 52 workers. Most of them targeted in the same way that Antoine was targeted, because they felt that he was not neutral, or they felt that they were not able to provide impartial support. And majority of them were volunteers. So in response to this, the IFRC, the president of the IFRC set up a solidarity fund last year at our General Assembly. It's called the Red Family Fund. And the idea is for the IFRC, the staff and the secretariat, to support families of the victims of those who've been killed, either staff or volunteers. And that we would as staff contribute, but we would also expect national societies as well to contribute. And we're also very honored that Protect Aid workers are also part of that contribution to the fund, to be able to provide some notion of support and solidarity to the aid workers. And as it was mentioned before, it doesn't bring back the loss of a loved one, but it shows a level of solidarity there. But we also know that this is just a Band-Aid, right? I mean, it's addressing the problem once it has happened. And so what we need to be thinking about is what else needs to be done. And so there has to be systemic investment in safety, security, the dictated needs of the local and national humanitarians. I think we've heard it today as well, that we often forget the volunteers. They need to be part of that process. There's also a need to have an enabling environment to change the narrative around what aid workers, and in particular local national staff volunteers, are doing. so that they can be viewed with empathy, with respect, with solidarity. I think there's a challenge that we are seeing, which we've not really addressed it today, but I think we need to be aware of, is that increasingly the role of AI, the role of misinformation, all of these things will continue to spread perceptions or misperceptions about what aid workers are doing, what local actors are doing. And by the time we respond to this, it's gone viral and we're not able to, we don't have the infrastructure to be able to respond to this. If someone puts up a video tomorrow on TikTok or whatever that says this organization is doing this, and we've had this actually, this in the past, where actually what we found was it was made up of different videos sewn together. So when you looked at the narrative, it set a particular narrative, but when you unpacked it, it was actually different videos put together. But by the time we as an organization unpack that video, the video's gone viral. And so the perceptions have gone. And so how do we control that? I think it's a question that we need to be able to understand and address and be aware of. And part of that means it's not just safety, security, and looking at when people are attacked, but also how do we counter some of these aspects of it. So I think that this is part of the challenge that we're having, and this is where I think we all need to come together to actually look at some of the opportunities for us to collaborate on this. Thank you.
Thank you very much, Amjad. So now basically we are slowly bringing this event to a close. I would like, just before handing over for the closing remarks to Dorota, just to mention 2 points, is that I think particularly in these times of hardship for the entire humanitarian sector, I think courageous leadership is actually to invest in care and protection at the grassroots. So this will ensure justice, equity, and better resilience for the humanitarian response. And number 2, as you will have known, it's a bit my motto, but I think victims and survivors, when they want to speak, of course, need to have a say and a seat, also to discuss the support mechanisms that are being put in place. Because I believe we need these insights from the families of victims, but also from the survivors, into what works and what can be further improved. Because in the end, whose justice are we talking about? Is it the organization or the individuals or the family? And whose mental health or physical health are we talking about? Thank you. Dorota.
Thank you. Thank you for the discussion. You know, I started off with the Einstein quote that if we're doing the same over and over again, we're actually insane expecting different results. But I think what I would like to put forward now after this discussion is that we do not necessarily need to be doing the same. We have to go into the granularity of it, be more focused. What clearly comes out of this very discussion is that, I mean, to my eyes, is that I mean, first, it's very nice to be coming here to Geneva over and over again and meeting the same faces. It's very nice to regroup. But what I believe is we have to get out of that and get out of the echo chamber and to go more local. So have kind of try to diminish the gap that we do see between discussions in Geneva, New York, Brussels, the headquarters, and what's happening in the field. I do see some elements already of that happening, and thank you very much, Kate, for what you have been saying. It's very encouraging to see that, for example, the attitudes toward impunity locally are changing. I think this is a very, very important sign, and it's something where we should dig deeper. And with protected workers, what we are trying together with Law is indeed establish this network of legal advisors, lawyers locally. And this for me is direction to pursue. The humanitarian diplomacy now is the new, how would I say, buzzword in Brussels. It's going to be repeated over and over during the European Humanitarian Forum. And again, what I believe would be great to do with it is not to, conceptualize and put forward in this type of fora, but to go deeper with it and to context by context, understand what concrete steps can be taken. And these will be different steps in each context, because as we know, it's one crisis is not another, and the factors that we have on the ground are very, very much different. So I would very much like that in, I don't know, a year time or 2 years time, if we meet again in similar group, that we can say that we have made several steps forward, and that we see at least a few positive signs, right? But for that, I think we do have to talk less and do more. And this is something that I would like to leave you with when you're going back to your organizations. Thank you.
Thank you very much. I don't know, I'm told, would we open for 1 or 2 more interventions if there are people who want to speak up? I don't know, Camille, you wanted to mention something?
Just a question, maybe. Thanks so much. Sorry, it was just a quick question, just to reflect on what, because I see that we have a few minutes left, on what you said at the ground level. And I was wondering if there was some experience or work done by some colleagues on the field to also at coordination level on the CMT or wherever, bring back this issue to the HET, to I don't know, on the Access Working Group, in some other field where also this discussion needs to happen, and to make sure that at the ground, our colleagues also could also directly engage with some parties to the conflict or the states with a common positioning. And I'm just wondering if those discussions exist. I'm pretty sure that experiences from Sudan also can be brought, but it was just a question from my mind. Thanks.
Any more interventions? Yeah. Yeah, but it's for the online audience. Yeah.
Thank you. So forgive my ignorance, but I wondered if anyone on the panel is aware of any kind of opportunity to get the Interagency Standing Committee and/or UN Security Council to really promote the importance of your good work. I mean, this is back to my comment earlier about it starting at the top. If the messaging from IASC were stronger on the whole issue of international humanitarian law, then it would come down to ground very quickly as being something that we will take very seriously.
Happy to kickstart on the answer on that. I think so there is first of all, I think the UN Security Council Resolution 2730 of May last year. And then, as we discussed, there are also some specific diplomatic efforts on the way. But I invite you all to also read, for example, the recommendations that came from the resolution in May 2024. There was an ask to have concrete recommendations from the United Nations Secretary General, which were shared with the Security Council in November last year. They're actually to a certain degree. We've done some work to compare resolutions. It's stronger language. It's a broader base for intervention. The problem is, again, this divergence between what is in the texts and what we see in terms of implementation. But the recommendations of November last year include the attention on local work, the inclusion of mental health and psychosocial support, the key issue of fighting impunity, the importance of amplifying the voices of victims and survivors. So I invite you to look at that document. Maybe it does not yet trickle sufficiently down at the state level, and in particular in the context of intervention. On that, I very much agree with Camille from ACF that more needs to be done there. But yeah, I think there is at least a broader consensus in terms of text. Kate, if you want to add.
I think one of the other things that's been discussed amongst humanitarians is in relation to somebody having the specific responsibility to follow up and to report on this, whether, several things have been discussed, whether that's a special rapporteur on the protection of aid workers, or whether it's given to the ISC or it's given to a specific role within OCHA or others, but to actually then to somebody who takes responsibility for reporting on the number of cases, bringing together the different recommendations, such as what is happening on accountability and justice, where is progress being made or not, what is happening in relation to the response and the support given to aid workers, and to bring it all together. So that certainly is something which has been discussed, because at the moment there's not a clear focal point for bringing all this together and presenting it regularly back to the Security Council, other than the Secretary General's recommendations.
We've had a few comments from people just saying thank you for a great session, but we also have a question on the subject of discrimination and prejudice. The question asks, how do you see the factor of race in the protection of humanitarian aid workers, and why is race often ignored in the discussion of protecting aid workers?
Yeah, it's a tough question, but I think that there's something. It goes back to what we were talking about, the local versus the international NGOs, right? And how each one of them is dealt with differently. And I think that what we've discussed today is that we know that local actors are much more likely now to be affected, because they're also part of the community, and often the perception of neutrality or impartiality doesn't go down to them. So I think that there much more needs to be done in that sense. But I mean, I think we've discussed it today, that this is part of the challenge that we need to be aware of. Not fully answered it, but I think it's something we need to be cautious of.
Perfect. I don't know if there were more questions or no. Okay. Otherwise, I would just close and then.
Can I just make one?
Sure.
Sorry, I forgot to make this because my colleagues have reminded me, and they will be upset with me if I don't say this, is that we have an exhibition by the cafeteria of sort of a photographic exhibition of the aid workers and everything else. So please, if you do have a chance to go there and sort of see the Protect Humanity campaign that the IFRC has been running. Thank you.
And I'll maybe also add to Amjad's point on the answer to the question with regards to maybe inequities, that I think also is just to remind ourselves that why we work in this sector is also for that value of justice. And I think that is also why I strongly believe we need not only to listen, but we actually need to hear directly from local actors. We need to definitely think that to make panels as inclusive as possible. And we need to indeed think, as Dorota was mentioning, to basically bring these conversations much more at the local level in order to avoid to have always the same representatives basically talking about the topic, which where in the end, the most affected population, if we can talk like that, is actually not present here. Thank you very much.